Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name is Malcolm and I am Chairman of the Isle of Man Anti-Cancer Association and a former surgeon.
And I'm Sandy. I'm the Executive Officer of the Isle of Man Anti-Cancer Association and a cancer survivor. In this podcast we want to talk about the role of family history in cancer. In our busy lives, family get-togethers are a good opportunity to meet and talk about what is going on as well as enjoying ourselves. During conversations, comments often come up, usually complimentary, about features apparently shared between members of the family, the newly born baby who has a face just like his dad, a child with an unusual eye colour identical to a cousin, a daughter with a singing voice just like her mother, a teenager who takes after her grandparent. These are all things that we recognise because we can see and hear them. There are also features which are not so pleasant and less readily recognisable. Inherited diseases which may not manifest themselves until later in life. So what role does a family history play in the risk of developing cancer?
We know that cancer arises as a result of so-called faulty genes associated with cell division. The majority of these faulty genes arise as a mutation at some stage during our lifetime, either by chance or through aging or other factors such as environmental or lifestyle issues. However, it has been estimated that overall somewhere between 5 and 10% of cancers occur because of an inherited faulty gene that runs in families, one that was passed on to us by one of our biological parents at the time of conception. A number of these faulty genes have been identified, for example BRCA1 and BRCA2, which are usually associated with breast and ovarian cancer, and more are being identified all the time.
It is said that we are all related to a certain extent with every 8th person that we meet. However, the number of genes that we might share with each relative varies. The closer we are related to an individual, the more genes we will share with that individual. Identical twins are unique as they virtually have all the same genes. A first-degree relative, that is your biological parents, siblings, and your offspring or children, will possess half of the same genes as yourself. A second-degree relative, a grandparent, grandchild, aunt or uncle, niece or nephew, or any half-sibling will have only a quarter of the same genes as you, with the figure getting even smaller with more distant relatives such as cousins. So the chances of you inheriting a faulty gene from a relative, if one exists, is higher the closer that relative is related to you. Remember, having a faulty gene does not mean that you will develop that cancer, but it is a significant factor in your risk.
There are a couple of other points to bear in mind. Cancer is fairly common, with anyone born after 1960 having a 1 in 2 chance of developing cancer at some point in their lifetime. This means that up to half of our relatives will also be affected by cancer in their lifetime. However, the majority of these cancers will not have arisen because of a faulty inherited gene. The first thing to remember is that relatives on our mother's side of the family have a different genetic mix to those on our father's side. So if your maternal grandmother and say an aunt on your father's side both had breast cancer, it is extremely unlikely that they would have arisen from an inherited gene fault. Different types of tumours usually arise from different faulty genes, so having relatives who have had different tumours, such as stomach, breast and lung cancer, make it again unlikely that they arose from an inherited gene fault. Age is also important. If there is an inherited gene fault, it will usually lead to a tumour arising at an earlier age, usually under the age of 40, but certainly by 50.
So when should we be really concerned that we are at risk of carrying an inherited faulty gene? You may be at risk of having an inherited faulty gene if 2 or more close relatives on the same side of the family have had cancer, those relatives have had the same type of cancer or different cancers that can be caused by the same gene fault, such as breast or ovarian cancer, the cancers developed when the relatives were young, so under the age of 50, or if one of your relatives has been found to have a gene fault, such as the BRCA1 or BRCA2 through genetic testing.
What should you do if you feel that there may be an inherited faulty gene in the family? First step is to talk to your GP. Your GP may want you to do a bit more homework to clarify the situation, such as produce a family tree, are the relatives all on the same side of the family, what specific types of tumours were involved, how old were the individuals when they developed their cancer. If your GP feels that you may have an inherited faulty gene, then you will be referred to a specialist clinic and probably see a medical geneticist who will delve further into your situation. You may even undergo a blood test to see if you have one of the known faulty genes.
If you would like more information about family history and cancer, the Cancer Research UK website is a good place to look, cancerresearchuk.org. Or you can visit the Macmillan Cancer Information and Support Centre up at Nobles Hospital. You can phone them on 650 735 or have a look at their website, which is cancer.org.im. Thank you for listening.